family, welcome back. We are going over your most frequently asked questions and we're doing a Q&A. So as you join, drop in the chat, where are you joining from? You know, I always like to know that. And what are your questions that you have? So we're going to go over your top 5 most frequently asked questions that we are getting asked the most lately. I will be looking at the chat. So if you have questions as you all join, where are you joining from? I see you all joining. Welcome. We're going over those frequently asked questions, you all, because we've been having so many good questions, so many good DMs, so many good comments on all our social media platforms. But there have been 5 that we have been getting back to back to back. So, you know, I love to come on live and just answer your questions, the frequently asked questions here today. And any questions you have live, I will prioritize your questions, drop them, I'll answer them, but I got to know where you guys joining from. So those of you who are new here, I'm Dr. Jade. Thank you so much for being here and taking your afternoon with me. I'm a board certified family medicine physician. I am the founder and medical director of Inspire Primary Care. This is my childhood dream come true, to serve my hometown with quality health care. Our mission is to provide high quality primary care to the Las Vegas Valley for professionals, families, and businesses in their team. And I'm really thankful that we've been able to do that really well for the last 4 years. And we look forward to many years to come. So if you are looking for a healthcare home, if you're like, I don't have a primary care doctor, I don't know who my primary care doctor is, I don't have a healthcare team or a healthcare home, or, you know, I'm having a bad experience where I'm at, I can't get in, I can't get appointments, I'm not being listened to. Like if those are the things you're saying, or even worse, I'm going out of town to get healthcare, I'm flying out of town to get healthcare, like Inspire is here to solve that problem for you, for your family, for your children, and for your businesses. So we would love to be your healthcare home, and you would just enroll in our practice at inspireprimarycare.com. No I in front of Inspire. But first, let me answer your most frequently asked questions, okay? All right, I see you all joining, but you haven't dropped in the chat where are you joining from. And if you have any questions as we go, let me know. Don't be quiet on me tonight. Okay, here we go. Your top 5 most frequently asked questions about Inspire and health. Here we go. All right. So number 1 is most frequently asked question is, you already know, do you take my insurance? I think this will always, I will be shocked whenever I do a frequently asked question Q&A and this one doesn't come up, because it's the question we want to know, right? So do you take my insurance? So I've been doing this 4 years, but I know there's always new people. So we're gonna keep talking about it. I don't know if you've heard of direct primary care, membership style practices for primary care, or concierge style practices. That is what Inspire Primary Care is. Why is that? Because that's the question. People are like, wait, why don't you take my insurance? It's not that we don't take your insurance. It's just that we are using insurance properly. So think about car insurance. When you go get gas, do you use your car insurance? Of course not. When you need an oil change, do you use your car insurance? Of course not. When you need windshield wipers or new tires, do you use your car insurance? Absolutely not. That would be a hassle. It would take a lot of time. You would be getting that gas in 3 to 6 months instead of right now. It would make everything very delayed and expensive. Instead, you know, when you get into a car crash, that's when you pull out that insurance card. So we are using insurance appropriately, or what we like to call it, catastrophic care, appropriately. Primary care is meant to be 90% of your healthcare needs under one roof, your healthcare home. So for that, we are using a flat, easy membership model called direct primary care, and your whole healthcare team is at your fingertips. Text, video, phone, in office, no copays, no hassles, no surprise bills, no delays. All right, so we're just using it and making the healthcare model the way it should be, about you, where your doctor and your healthcare team works for you, and where we collaborate and make your health an easy and exciting way to actually access healthcare, a healthcare team you actually want to be a part of to help keep you healthy. So the answer is, do we take your insurance? We don't bill insurance for our primary care services in office. Again, primary care is 90% of healthcare needs. You can think of us like a gym membership, but for primary care, we have an easy monthly or annual membership. All of your primary care is at your fingertips. And then catastrophic care, we do recommend. That's frequently asked question number 2. All right, I see you guys joining. Where are you joining from? All right, so membership model for the primary care, that's number 1. This leads to frequently asked question number 2. I had a few calls this morning, people asking this, and some corporate partner discovery calls asking this. Well, do we need insurance if we use Inspire? Like, does that mean if we join Inspire, if we as a family join Inspire, or if my business signs up with Inspire, Does that mean that we no longer need insurance? So the answer to that is, instead of us thinking about it as insurance, let's think about it as what it should be, which is catastrophic coverage. Catastrophic coverage is for the 10% of care that falls outside of the primary care office, whether that's imaging or medications or something more serious like going to the emergency room, hospitalization, surgery, right? So we want a catastrophic plan for emergencies. For most adults, this is going to be about 10% of care that falls outside of the primary care office. So what we should do is customize the catastrophic option that is best for you as an individual, for your family, or for your business. The one that makes the most sense and is actually going to get you the type of healthcare that you need when you need it, right? When you need that emergency care. So what we recommend, we do have a percentage, about 30% of our practice has Inspire only for their healthcare, and then they save up for a rainy day in case they need catastrophic emergency care. What is recommended, though, is to have some sort of catastrophic care customized option for the emergency needs that fall outside of the primary care office, okay? And there are more options and smarter options than just a traditional PPO HMO plan. Everyone who joins our practice, we kind of talk through what is the best catastrophic option for their specific health, for their individual healthcare needs. But I'll tell you the most common ones that our members typically use. Most of them, if they get their healthcare through like an employer and they're already being offered a PPO and HMO that's affordable, not many things these days are affordable, but if they are getting it and their employer is contributing most of it, then they'll add on Inspire Primary Care as the primary care aspect, and then use the catastrophic care as needed for the things that fall outside the office. But what most people do, especially people who are getting their own healthcare, like most of our entrepreneurs and business owners and contractors that join our practice, they do one of these things. Have you heard of an HSA high deductible health plan? So most of them will get a HSA, a health savings account, and then they will contribute, or their employer will contribute to the HSA, and those can be used for any of our plans that Inspire. So HSA is accepted. And then they will use the high deductible health plan. So that's a plan that has a higher deductible because it's meant for emergency things. It's meant for surgeries, hospitalizations, right? It's meant for things that are going to cost more money. And that way Inspire takes care of everything else. Okay, so that's what most of our members will do, is a high deductible health plan with an HSA, or a high deductible health plan alone paired with Inspire, or I don't know if you've heard of something called a health share. Look that up. But many of our members will do a health share, and we have a specific health share company that we recommend to our members if that is the best fit for their healthcare. Or they will do, if they're shopping on the marketplace, they will do one of the bronze plans, they'll usually call it, okay, which is equivalent to a high deductible health plan. But all of those have a lower monthly cost, so they are paired well with Inspire for a more comprehensive, customized health care selection that actually gives them the care that they need and the access that they need. Are you guys tracking with me? I see you guys here. You're quiet on me. Where are you joining from? And do you have any questions? And does that make sense? Okay. Lately, I talked to my husband, and at the end of my sentences, I say, does that make sense? And he told me, stop saying, does that make sense? So I said it once on this video. I'm going to try not to say it again. All right. So you all are here. I'm going to assume that it makes sense unless you drop a question, and I'll move on. All right. So that's number 2. All right. Frequently asked question number 2. Should we still have insurance? We like to think of it as catastrophic care. Yes, catastrophic care, a customized catastrophic care option is recommended, but let's not just take the old school thing that everybody takes. Let's actually look at what's actually needed and put together the best, combination that's right for you and your health and your family. All right, here we go. Number 3. Frequently asked question number 3 is, are you accepting new members? So it's interesting because on our social media, I feel like every day I tell you guys we're accepting new members, but thank you so much for all of you all who are in different social media groups and Facebook groups and all of these things, because a common question in these different groups is, does anyone know a primary care doctor in Las Vegas? Or I'm looking for a primary care doctor in Las Vegas. And I love you guys for tagging me. You guys tag me all the time, and you say, Dr. Jade and Inspire. And yesterday I was in a chat where I was tagged, and somebody commented, shout out to you, somebody commented and said, oh, I heard that Dr. Norris is no longer accepting patients and she's not accepting new patients. And I'm like, you guys, I say it every day that we're accepting new members. So I'm going to pause and take a sip of water because apparently I need to. Drop in the chat where y'all joining from. Okay. But yes, we are accepting new members to our practice. I think the confusion is because our healthcare team has grown, which is the beauty of a business that's being blessed, is that the team grows. And so absolutely our practice, Inspire Primary Care, is still accepting new members. And all of the first appointment, which is called an onboarding appointment, our nurse practitioner Noelle does do the first appointment called our onboarding appointment for all new members. After that appointment, you're free to see whoever you would like to see in our practice. You can see Noelle, you can see me. Our whole healthcare team is at your fingertips, and we work together as Team Inspire. So we are definitely still taking new members. I am still happy to be your primary care doctor, as well as our full Team Inspire to be your healthcare home and at your fingertips. So hopefully that clears that up. I was like, oh, that's fake news. Like, wait, where do we get that from? Like, am I not telling you guys every day, all day that we're accepting new members? What's happening here? So let me clear that up. So that's frequently asked question number 3 lately. Just because you see more faces does not mean that I am no longer accepting new members. I would love to be your doctor, but just know you will have the whole Team Inspire at your fingertips. It's more brains for the same price. Okay. All right, here we go. Frequently asked question number 4 is we've been getting, of course, it's the beginning of the year still, although it's crazy that it's about to be March. Like, what? Okay. But we've been getting a lot of questions about GLP-1s and medical weight loss. Do we do that? Do we offer that? We've been getting a lot of questions about hormone management, and do we manage that for both men and women? We've been getting a lot of questions. It's very trendy right now to talk about longevity care and peptide care. And so we've been getting all of those questions. So I am certified in medical weight management as well as hormone and longevity medicine, trained in those. So we do offer all of that, a part of our Inspire specialty tier. So we have 4 tiers at Inspire Primary Care. All right, we have Inspire Virtual. That's for people who just need virtual care. They're like, I just need refills. I just need to be able to text, email when I have questions. I don't really need to come in office. I don't need specialist referrals. That's our Inspire Virtual plan. All right. Low cost plan, easy access to virtual care. All right. And then we have our classic plan, which most of our members will have this plan, which is our Inspire Concierge. That's going to be where you also, in addition to virtual care, you also can come in office for appointments. You have access to all of our procedures, which are included in membership. And you also have scheduled appointments, right? And longer appointments and priority appointments. So that's our Inspire corporate. Our Inspire Concierge. And then our third tier is Inspire Specialty, which was what we're talking about with FAQ number 4. And that is everything else we talked about: virtual care, concierge primary care, and in addition to that, access to our medical weight loss program, our hormone management program, and our longevity or peptide program. So all of that is available here at Inspire. Of course, we include primary care into all of our membership tiers because that is the meat and potatoes of what we all need, even if we think we just need to get snatched. Like, we still want to have that primary care on deck. Whether you use it or not, it's included in every plan. Okay. And then the last plan is Inspire Corporate. So that's our last tier. And that is for Las Vegas businesses, small, medium, or large businesses that have teams. And that is where they offer Inspire as the healthcare benefit to their team. That is if you have 5 employees or more, and you as an employer want to offer Inspire as the healthcare benefit to your teams. We are blessed to be the healthcare benefit for many companies in town, from the lounges downtown to the schools to the daycares. It's been a blessing to take care of businesses and their teams. So if you are a business owner with a team, or if you are an employee and you're like, wait, they're not giving us benefits, or the benefits we have, we don't even like them and I can't even access them when I call around, connect us with your employer, or if you're a business owner, connect with us. We start those off, the Inspire Corporate, we just start those as a discovery call. And we start off with just a conversation of me explaining how Inspire Corporate works, hearing about your business, and seeing if what we offer is a good fit for your team. So very, low pressure, and we love to connect with any businesses in town that would like to offer a high quality and affordable healthcare benefit to their teams. All right. So that's Inspire Corporate. All right. I think those are I had one more. Frequently asked question number 5. This one comes up a lot, so I don't want to skip this. People ask about, well, what about labs, meds, imaging, and referrals? Like, do you do that? Like, yes. So it is confusing. I can understand the confusion because we're a membership practice. So it's like, wait, what do you do that a traditional doctor does versus, you can think of us like a traditional doctor, just higher access, higher quality because we just have more time and we don't have the insurance hassles. But we operate just like your typical doctor's office. We absolutely send medications to your pharmacy if you need it. We had the question this week, like, oh, well, what if I'm more wellness focused and I don't just want a pill? I specialize in prevention and lifestyle medicine. So absolutely, if you want more holistic and lifestyle-based recommendations, we absolutely do that. But if you need a medication, like you have a UTI or whatever, we absolutely send the medications to your pharmacy, just like a typical insurance-based practice would, right? So then the question comes, well, then do I use insurance at the pharmacy or do I not? If you have insurance, you can use your insurance at the pharmacy. If you don't have insurance, we have wholesale discounted coupons that we give to our members at the pharmacy, which makes generic medications very affordable, most of them under $20. So medications, really easy. Same thing happens with labs and imaging. When we order labs for you, you can use our wholesale discounted rates, which are 90% discounted compared to using insurance. So for example, a full panel of annual labs is only $58 with our wholesale discounted member prices. All right, like a CBC, $6, a hemoglobin A1C, $6. Our full panel is only $58. That's if you use our wholesale rates. But if you say, man, I want to use my insurance for my labs, that's no problem. We send the order over and the lab, like LabCorp Request, will process your insurance. So you get to choose if you use our cash rates or if you use your insurance, if you have insurance. Same thing at the imaging center. We have wholesale cash rates for MRIs, X-rays, CTs, etc. MRIs are only $300 cash, but if you want to use your insurance, you can do that. They may send you a bill for $800, but it's up to you. You have the choice, right? Mammograms, our cash mammograms during breast cancer month in October is only $99. We can do cash X-rays, same day walk-in for $25. So these are the discounts. You can think of us like a Costco in that way, where we have negotiated wholesale rates with labs, imaging, and medications, and that is a pass-off benefit to our members. All right. Or if you have insurance, you can use insurance. So I hope that clears that up. Yes, we order labs, meds, imaging, and if we need to send you to a specialist, we refer over to a specialist. If you have insurance, you can use your insurance at the specialist office. So hopefully that clears that up, but I am happy to answer as many times as you guys want. Do we take insurance? Because we are a membership medical practice in a direct primary care model, but you can use your insurance for the 10% of care that falls outside of our office. All right, y'all, there's a few things, okay, that I want you guys to know. First of all, we have our Inspire community. Regardless if you are a part of Inspire as a member or not, we want to connect with you in the community. I want to connect with you in the community. So we have different ways that we connect with you guys in the community, and we want to see you there, okay? So the first community event that we have recurring is our Las Vegas Leaders Lunch and Learn. Say that 5 times fast. Our Las Vegas Leaders Lunch and Learn. Our Las Vegas Leaders Lunch and Learn is every other month, first Friday. This is specifically for Las Vegas leaders. I mean, it's pretty clear in the messaging, right? So for entrepreneurs, business owners, corporate, anything where you basically control your own schedule and can come and have lunch with us midday on a Friday, first Friday. We want to see you there. So that's first Friday every other month. The next one is going to be April 3rd because we just had one, okay? April 3rd, mark your calendars. It'll be in our stories and the link will be in bio. It's a free lunch. We're treating you to free lunch, okay? It is sponsored by Northwestern Mutual and Inspire Primary Care. So lunch is on us. We do a health and wellness topic that you guys want to hear about each time. So we do networking. So at the beginning and the end, there's networking. We have free lunch. And I do a health and wellness presentation on topics that are hot topics in the community. So we would love to see you all at our Las Vegas Leaders Lunch and Learn, April 3rd. Definitely RSVP. Our last one was fully booked. So we have just partnered with a local restaurant. I'm excited. That has a bigger capacity so we can take more leaders at the next one. So we look forward to seeing you there. Now, ladies, lean in. Brothers, step back for a minute. This one's for the ladies. Have you guys seen? So you guys know, if you don't know, I love pickleball. My name is Dr. Jade and I love pickleball, okay? And pickleball is super fun. I'm biased because I love it. And so God told me to launch the Lady Leaders Pickleball Meetup. I'm really excited about it, can you tell? And so we had our first meetup 2 weeks ago. We're gonna do that one every other week. So every second and fourth Tuesday, the Lady Leaders Pickleball Meetup, okay? I'm gonna keep putting it in the stories. We had the best time. About 10 of us ladies met up a couple weeks ago, and we have a private group chat. It's our Lady Leaders Pickleball Meetup group chat on IG. So DM me or comment the word pickleball if you're a lady leader in the Las Vegas community and you want to come hang out and do pickleball together. What is the purpose of this? So think about this. Now, I know women golf, but think about how traditionally men go to the golf course and they have their day of golf, and then they come back and they've closed deals and they've made connections and, you know, all the things. That's what we're doing for pickleball. We are connecting, we are collaborating, we're doing it over wellness, we're having fun while doing it, and we're also getting to know each other. And the whole point of it being Lady Leaders is like, man, what do you do? What gifts and talents do you have? Who can I connect you with? Who would benefit my members, you know? So I always love to connect the different women in the community. I want to know what you do. I want you to know what we do, because even if it's not a good fit for you, it may be a blessing for someone that you know. So if you're a lady leader, DM us the word pickleball so you can join our IG group chat. And we want to see you this upcoming Tuesday, okay? All of the details of our meetup will be in the group chat. So meet us there. And I really am excited about that one. I was glad that God gave me that vision because, I mean, hello, networking over pickleball is like a dream come true for me. So Lady Leaders Pickleball, Las Vegas Leaders, Lunch and Learn is April 3rd, and Lady Leaders Pickleball is every second and fourth Tuesday, and we want to see you this upcoming Tuesday. DM me pickleball to get in the group chat. Okay, those are all my community updates. And the last thing is, who do you know that would benefit from Inspire Primary Care as their healthcare home? This is for professionals, families, business owners, and their teams, okay? My mission is to provide as much of the Las Vegas Valley and beyond with quality primary care, where it's easy access to see your doctor and your healthcare team, where they're a text message away, where there's not a hassle, where you don't have to chat GPT and Google everything, where it's like, I know you, you know me, we can help keep you healthy. Or if you're not where you want to be in your health, we can transition you to a healthier lifestyle, healthier weight, help you to prevent and reverse chronic disease, and help you to age well. Like, that is the mission of Inspire Primary Care. It is my pleasure to care for my hometown. Next step would just be to text the word info to Team Inspire. We're at 702-867-0017. I talk fast, so I'm gonna say it again. 702-867-0017. If you want to enroll, you just enroll at our website. It's inspireprimarycare.com. No I in front of Inspire. There's an enroll button. You click it. That's how you enroll. But if you just have questions and you're like, man, I have some, because y'all didn't say nothing on the chat tonight. I mean, I see all of y'all joining and y'all haven't said a word to me. Okay, hold on. Soul DPC, my soul sister. So my other doc friend, I have a lot of doc friends across the country, and one of my doc friend is in Atlanta. So Soul DPC is a practice like Inspire Primary Care in ATL. And she said, hey doc, she's the only one who has talked to me tonight. Okay. But that's okay. I see y'all here. ATL is in the house. I can see ATL is in the house, and I see several of you who I know are in Las Vegas. So Vegas and Atlanta are in the house. Hey doc, it's always good to see you. Thanks for holding it down out there in Georgia. If you're in the Atlanta area, definitely check out Soul DPC. Okay, shout out to my friends. And if you're in the Las Vegas area, Inspire is meant to be your healthcare home. And if it's not for you, who do you know that's looking for quality primary care? What businesses do you know that are looking and could benefit from offering this to their employees? And if you're a business owner, connect with a discovery call for Inspire Corporate. It's been a blessing to care for so many businesses and their teams. And if you work for a Las Vegas business and you are not being offered benefits, healthcare benefits by your employer, connect us with the decision maker at your business so that we can show them how we provide accessible and affordable quality primary care to employees throughout the Valley. So it's my pleasure to care for you guys. My main thing is, are you joining me for pickleball, ladies? Like, let's go back to that. No, I'm just kidding. Okay, it's always a pleasure. Clearly, I missed you guys. It's been a couple weeks since I've been able to come on live, so it's good that I was able to carve out some time. Thank you for being here tonight, even though you didn't say much to me in the chat. I see that you're here, and I'm thankful, and I look forward to seeing you guys in the community at either the Las Vegas Leaders Lunch and Learn or at the Lady Leaders Pickleball meetup, or thank you for being a part of our social media family. So I'll see you guys next time. Bye.